A wonderful day to all of you guys. In this video, I am going to talk about the management of patients with musculoskeletal trauma. So previously, we have already discussed the review of the musculoskeletal system, the nursing health history, physical examination, and diagnostic procedures relating to the musculoskeletal. And then we also have discussed the different modalities such as cast, splints, braces, external fixators, tractions, different orthopedic surgeries such as total hip replacement and joint replacement or arthroplasty. So these are the different care modalities involving the musculoskeletal. Now, we are going to discuss yung mga trauma naman involving the musculoskeletal. And to begin with, we have here contusions, strains, and sprains. Just like being flashed in this GIF, Stephen Curry, when he incurred a sprains in his left ankle. So commonly na-encounter yan ng mga athletes natin wherein they're involved in contact sports or such as like this, basketball. So let's talk about first contusion. So when we say contusion, it is a soft tissue injury that is produced by blunt force such as a blow, kick, or fall. So that is a contusion. So blunt force lang causing soft tissue injury such as this one, yung image na meron tayo. So many small blood vessels rupture and bleed into soft tissues. Kaya tayo nagkakaroon ng ecchymosis or bruising. So a common feature ng contusion is merong bruising or tinatawag nating ecchymosis because there is a rupture of small blood vessels in that soft tissue na involved sa injury. Now, a hematoma develops when the bleeding is sufficient to cause an appreciable collection of blood, resulting in a characteristic black and blue appearance. So kapag merong sufficient collection of blood, or I mean bleeding, so hematoma occur. So we have here, ito yung characteristic na black and blue appearance, just like ito namang second picture natin. So kitang-kita natin na talagang namuo yung, kumbaga yung tinatawag natin namuo yung dugo because of the injury. So there is a hematoma and the appearance is black and blue. So there is an accumulation of blood in that injured part. Now, over 2 or 3 days, the contusion changes to a yellowish color and usually resolves completely in 1 to 2 weeks. So yun yung time natin para ma-heal yung ating contusion, yung injury na yon. So naiiba yung kulay niya as healing occurs or develops. So that's the first contusion. So the second one, strain naman. So when you say strain, or this is also the muscle or tendon pull kung tawagin. Again, strain is a muscle or tendon pull. So meaning na pull or parang like na parang na stretch si muscle or si tendon, and that a strain is an injury caused by overused, overstretching, or excessive stress. So these are the causes kung paano ka magkakaroon ng strain. So pwedeng na-overuse mo yung iyong tendon, na-overstretch, or because of an excessive stress. Such as in this image, so nakita natin this is our tendon. Sa tendon, it is like the one that connects your muscle to the bone. So parang siya yung bridge connecting the muscle and to your bone. So ito, the tendon here, such as the Achilles of tendon or Achilles tendon, kung tawagin. So, pag zoom natin, ito, nagkaroon tayo ng strain, somehow parang na overstretch or nagkaroon ng stress dito sa part of the muscle in this picture or in this image. Now, dito sa second picture natin, we have here a strained Achilles tendon. And there are three different grades of tendon strains. So commonly, meron tayong grade 1, 2, and 3 for strained tendon. So for grade 1, stretching is, so there is a stretching and then there's a minor tear sa tendon. So it's just like this one. Grade 2, there is a partial tear. So makikita natin na somehow parang may konting punit na nga. And then for grade 3, talagang nag-ruptured na mismo yung tendon. So somehow parang natanggal or nasira na talaga yung tendon, that parang naputol or napigtas yung tendon for that matter. Okay, so this is a strain. So again, strain is a muscle or tendon pull. And then there's another term kasi na somehow napagpapalit natin yung definition. So the first one that we have discussed is strain. This second term is called a sprain. Pag sinabing sprain, it is an injury to the ligaments surrounding a joint that is caused by a wrenching or twisting motion. Diba? Some of our our joints are surrounded by ligaments. So, itong ligaments na to parang ini-embrace niya yung ating mga joints, providing like more mobility sa ating joints. So in the case of sprain, ang nai-injured is si ligaments that surrounds the joint. So that is the difference of strain with sprain. Yung kaninang strain, the injury occurs in the muscle or in the tendon. On the other hand, for the sprain, the injury occurs sa ating ligaments. Okay? So that is caused by nagkaroon ng wrenching or twisting motion such as this one. So parang ano ba tawag dito? Parang natapilok. Okay? Yung for example, yung iyong ankle and then nagkaroon ka ng sprain kung tawagin. So a torn ligament loses its stabilizing ability, so blood vessels rupture resulting in edema and joint tenderness with increasing pain when the affected joint is moved. So, torn, if that is the case, if the ligament or if there is really a sprain, so definitely yung ligament mo is parang na torn din or somehow na damage. And then, again, the blood vessels will rupture just like yung sa kanina natin sa ating contusion, resulting in edema and then may pananakit ng joints. And then definitely increasing pain when the affected joint is moved. So kaya naman mahalaga na immobilize, meaning talagang mawalan or i-control natin yung movement of that affected body part. So the degree of disability and pain increases during the first 2 to 3 hours after the injury. So yung pain na meron si sprain increases during first 2 to 3 hours after the injury because of the associated swelling and bleeding, especially if treatment is delayed. So mahalaga yung treatment agad or yung intervention na maibigay natin sa mga nagkaroon ng sprain. Okay, kasi talaga magsuswell yung tissue involved and the ligament. Okay, so for the nursing management involving contusions, sprains, and strains and sprains, so we have the acronym RISE. And alam natin to when we are handling a strain or a sprain. So we use the intervention, the acronym RISE. So when we say RISE, R-I-C-E, we refer to rest, ice, compression, and elevation, which is helpful for remembering the treatment interventions for contusions, strains, and sprains. So that is RISE. So let's start with rest. So R is for rest. It prevents additional injury and promotes healing doon sa affected body part. Second, you have the ice or we apply moist or dry cold intermittently for 20 to 30 minutes during the first 24 to 48 hours after injury, which produces vasoconstriction, decreases bleeding, edema, and discomfort. So that is the reason why we are applying ice on the affected body part. So intermittently, remember we apply the ice intermittently for 20 to 30 minutes. And again, that is for the span of 1 to 2 days after the injury. So that is the second intervention, we apply ice. Third, you have the compression, wherein we apply an elastic compression bandage that controls bleeding, reduces edema, and provides support for the injured tissues. So that is compression. And then the fourth intervention is elevation, which controls the swelling. If the sprain is severe, such as torn muscle fibers and disrupted ligaments, surgical repair or immobilization by a cast, splint, or brace may be necessary so that the joint will not lose its stability. So, na-discuss na natin yung mga modalities na yon, di ba? Si cast, si splint, and si brace, which is very helpful in immobilizing the affected body part. Okay, so this is the interventions for contusions, sprains, and strains. So rest, ice, elevation, and compression. So baliktad. So rest, ice, compression, and elevation. So that is rise. Okay, so what else? To continue the nursing management for this trauma of the musculoskeletal. So there is an increasing move towards less rest. So di ba nabanggit natin na we immobilize the affected body part tapos nire-rest natin as part of the intervention. Now, there is an increasing move towards less rest and a greater increase in the mobilization of the injured joint, particularly when the injury is of low grade. So kung yung injury, for example, yung sprain is grade 1 lang or yun na nga, very minimal lang or yung damage is not that so serious. So we are promoting now, or there's a greater increase in the mobilization of the injured joint. So that is according to Van den Beckerom et al. So mas maganda raw na we mobilize immediately the affected body part if it is if the grade is a low grade or yung injury is not that severe. Okay? So that is like a current research on this intervention. Now, after the acute inflammatory stage, such as 1 to 2 days after the injury, heat may be applied intermittently. So again, after the acute inflammatory stage, like 1 to 2 days, so pwede na tayong mag-apply ng heat. So meaning, after the application of cold or ice doon sa ating affected body part, like 1 day or 2 days, it should be followed by heat naman. Again, it is applied intermittently for 15 to 30 minutes, 4 times a day. That is to relieve naman muscle spasm and to promote vasodilation, absorption, and repair. So yun naman yung purpose ng application of heat after the inflammatory stage. So like after 2 days of the injury. So after we use the ice or a cold packs doon sa affected part, so heat naman yung na-apply natin. Like 2 days after the injury. Now, depending on the severity of injury, progressive, passive, and active exercises may begin in 2 to 5 days. Again, it depends pa rin sa grade niya or the severity of the trauma. So, pwede na mag-active exercises like 2 to 5 days after the injury. Now, severe sprains may require 1 to 3 weeks of immobilization before protected exercises are initiated. Again, for severe sprains, so it would take 1 to 3 weeks of immobilization bago makapag exercise si patient. Okay, so strains and sprains may take weeks or months to heal. So, medyo matagal din yung healing ng strains and sprains. Okay, so another nursing management is the neurovascular status. So remember this because for the entire discussion, we are going to refer to this as our nursing management sa mga may problema with musculoskeletal. So neurovascular status. We assess the neurovascular status of our clients involving the circulation, mobility, and sensation. So again, when we refer to neurovascular status, we refer to the circulation, mobility, and the sensation of the affected body part. So it is monitored every 15 minutes for the first 1 to 2 hours after injury. Kasi that time is crucial bago pa lang yung trauma or yung injury. So it should be monitored every 15 minutes for 1 to 2 hours after the injury. And then every 30 minutes na kapag until stable na yung injury or stable na si patient. Now, ang importance nito is we are monitoring for the complication of compartment syndrome. We do not want compartment syndrome to happen to our patient. That is the reason why we are monitoring for the neurovascular status. And in our assessment of the neurovascular status, we are we're going to remember the 5 P's of the neurovascular assessment. So the first one is pain. So we are asking the patient for any pain on the affected body part, and then yung pulse, meaning yung pulselessness. Kung nagde-decrease yung pulse ng affected body part, that is an important assessment to note sa pasyenteng sa pasyente nating involving this condition. Pallor, meaning the color of the affected body part. Paresthesia, yung feeling din ni patient sa affected body part, like, can you feel this? Such as, indicated in this image. And then, the 5th P is the paralysis. Tinatanong natin, can you move this? Meaning yung body part. So, these are the 5 Ps in assessing the neurovascular status of the patient. So, we have pain, pulselessness, pallor, paresthesia, and paralysis. So take note of this. So that is the first trauma na discuss natin with the musculoskeletal. So contusions, strains, and sprains. So the second trauma involves the joint dislocations. So in this image, ayan. So knee dislocation ito. Ayan, that is how your joint sa knee can be dislocated. Sige, let's talk about it. So dislocation of a joint, this is a condition in which the articular surfaces, meaning the joint of the bones, no longer in anatomical contact. So kapag wala na sa tamang contact yung ating joints, then nagkaroon na tayo ng dislocation of that articular body part. So the bones are literally out of joint. So yung bones natin ay hindi na meaning nagkahiwalay yung joints na yon. We have another term here, subluxation. This is a partial dislocation of the articulating surfaces. So meaning hindi totally karoon ng dislocation. Hindi siya totally na out of joint. Partially lang. So that is subluxation. So trauma dislocations are orthopedic emergencies because the associated joint structures, blood supply, and nerves are displaced and may be entrapped with extensive pressure on them. So it's medical emergency na dapat ma-solusyonan agad, madala sa hospital and be treated by a physician para maayos agad. So, if the dislocation is not treated promptly, avascular necrosis, pag sinabing avascular necrosis, it means diminish ang blood supply resulting in anoxia leading to tissue death. So, magkakaroon tayo ng tissue death when we say avascular necrosis doon sa body part na affected and a nerve palsy may occur. So, affected din yung nerve ng pasyente. Okay, so that is for traumatic dislocations. So, clinical manifestations ng joint dislocation, there is an acute pain. So, definitely, talagang patient will be complaining of pain, joint deformity, shortening of the extremity, and decreased mobility. So, dislocations may be congenital, meaning sa pagkapanganak ay nagkaroon na ng problema, most often sa hip ni baby, spontaneous or pathological, meaning it's a disease process, or traumatic resulting from injury in which the joint is disrupted by force. So these are the common causes kung bakit nagkakaroon ng dislocation ang isang pasyente. Now, medical management natin, the affected joint needs to be immobilized. So we have to immobilize agad-agad yung affected body part or yung joint. It requires prompt reduction. So meaning, dapat ma-reduce agad. When you say reduce, yung displaced body parts are brought into normal articular position. So kung nagkaroon ng dislocation, di ba, magiging abnormal yung position ng joints. So when you say reduction, yung dislocated body part na yun, aayusin natin into its normal articular position. So that is what we mean by reduction. Aayusin natin, if you fix natin, yung nagkaroong problema na joint or bone sa ating pasyente. So that is what we mean when we say reduce or reduction of the bone. That is to preserve joint function and prevent complications. Kaya ginagawa si reduction. Now, analgesia, muscle relaxants, and possibly anesthesia are used to facilitate close reduction. Pag sinabing close reduction, we do not perform surgery, di natin binubuksan open yung pinaka-affected body part, kaya nga siya closed, tapos nire-reduce natin siya using, nire-reduce natin yung affected body part ng closed siya without opening the, yung affected body part. Okay? So I hope that makes sense. So, that is close reduction. So, inaayos natin yung affected body part without opening or without an open surgery. So that is close reduction. So ayun nga, pwede tayo magbigay ng analgesia, muscle relaxants kasi that would be painful on the part of the patient kapag i-reduce natin yung nagkaroong problema na body part. So the joint is immobilized by bandages, splints, cast, or traction and is maintained in a stable position post-relocation. So as a treatment, immobilize agad yung body part na affected using splint, bandages, or kapag available na cast or traction. Such as in these images. So this one is a brace and then this one is a cast. So nursing management natin, we focus on frequent assessment and evaluation of the injury. So again, neurovascular assessment na naman, yung 5Ps natin. Okay? So that is for the neurovascular assessment. So si circulation, si sensation, and si mobility. 5Ps. So remember that for the neurovascular assessment. So that is for the joint dislocation. So that is the second na trauma na i-discuss na natin. So the first one is contusions, strains, and sprains. The second one is joint dislocations. The third part is about fracture. And this is the last part of the musculoskeletal trauma na i-discuss natin. And medyo lengthy, medyo maraming concepts involved in discussing fractures. Okay, so these are the examples of fractures or types of bone fractures. You have transverse, stress, oblique, green stick, and comminuted. So, madidiscuss natin siya later on. So, when we define fracture, it is a break in the continuity of bone and is defined according to its type and extent. So, kapag ka nagkaroong problema sa continuity of your bone, so fracture might be or it may result into fracture, a break in the integrity or continuity of the bone. So that is fracture. So it occurs when the bone is subjected to stress greater than it can absorb. So pag nagkaroon ng stress ay yung bone or nagkaroon ng trauma in your bone, tapos hindi niya na na-handle, so it might get fractured. Now, it is caused by direct blows, crushing forces, sudden twisting, motions, and even extreme muscle contractions. Now, when the bone is fractured, the adjacent structures may also be affected, potentially resulting in soft tissue edema, hemorrhage into the muscles and joints, joint dislocations, ruptured tendons, severed nerves, and damaged blood vessels. So, medyo marami tayong problema kakaharapin kapag nagkaroon tayo ng fractured patient or pag si patient ay nagkaroon ng fracture. Ang daming problem na associated. So, it's like soft tissue edema, hemorrhage, sa muscles and joints, joint dislocation, possible then, and then ruptured tendons, among others. So we have types of fracture here. So first, we have complete versus incomplete. So when you say complete fracture, it involves a break across the entire cross-section of the bone and is frequently displaced. It is removed from a normal position. So in this image, so this one is a complete fracture. Kitang-kita naman natin na naputol talaga, nabali talaga si bone. So if that is the case, then we call that as complete fracture. The second type is incomplete fracture, such as this image. For example, a green stick fracture. So green stick fracture is an example of an incomplete fracture, wherein the break occurs through only part of the cross-section of the bone. So hindi siya totally na putol or nabali, partly lang or partially meron pang natira, okay, na magkadugtong yung bone. So, this is incomplete fracture. Ibig sabihin na totally bali yung buto, may natirang magkadugtong. Now, comminuted fracture is one that produces several bone fragments. So, this one naman is a comminuted fracture kung saan nagkaroon tayo ng several bone fragments. So, nabali sa buto, tapos yung nabali na yon broke into pieces. So, several bone fragments. So, that is comminuted fracture. So, that is the first, these are the types of fracture. So, we have according to either it is a complete or incomplete fracture. So, we also have the closed versus open fracture. So, very simple. Pag sinabing closed fracture, this is a simple fracture and one that does not cause a break in the skin. Pag sinabing closed, hindi lumabas yung bone sa body part. So, it is the skin is okay yung kanyang integrity. Hindi nagkaroon ng break in the skin, the bone is still inside. Okay, so that is closed fracture. It is a simple fracture. On the other hand, when you say open fracture, it is a compound fracture in which the skin or mucous membrane would extend to the fractured bone. So in this example, so this one is a closed fracture. Although nagkaroon tayo ng complete fracture, pero hindi siya lumabas sa ating skin or sa balat ni patient. So that is closed fracture. Now, in this sense, open fracture siya kasi lumabas siya, nagkaroon sa break or nagkaroon ng break in the integrity of the skin of the patient. So, and this one is also a complete fracture kung saan totally nabali yung buto. So open fracture again, yung skin or mucous membrane won't extend to the fractured bone. So that is a type of fracture, either closed or open fracture. And now these are the other types of fractures. I will leave this for you to read na lang. So you have avulsion, comminuted. Na-discuss naman na natin yung iba. Compression, impacted green stick. Common tong sa green stick natin, a fracture in which one side of a bone is broken and the other side is bent. So ito yung kaninang nasabi natin. So epiphyseal, tapos you have a depressed fracture. Then you have oblique. Ito si oblique fracture. Open. Yun na-discuss na natin yan. Pathological. If it is due to a disease process. Transverse, stress, spiral, and simple. Okay, so si open fractures, they are graded according to the following criteria. So kung kanina si sprains natin, di ba? Si strain natin, meaning yung torn na tendons natin, kanina with Achilles tendon, so it can be graded as grade 1, 2, and 3. Grade 1 being the minor. So in this case, for fracture naman, we also have grades. So open fracture to, no? So open fracture grade 1, this is a clean wound, less than 1 centimeter long. So this one is a clean wound less than 1 centimeter long. And then grade 2, it is a larger wound without extensive soft tissue damage or avulsion. And then so grade 3 is highly contaminated and has extensive soft tissue damage. So ang pinaka-less pa rin in terms of the open fractures is you have grade 1 and then yung severe is grade 3. So talagang extensive yung soft tissue damage for grade 3. So those are the gradings or the grade for open fracture. Now, ano yung clinical manifestations for a fracture? So it may include pain. So laging associated commonly si pain kapag musculoskeletal ang problem. So there is a pain, loss of function, deformity, shortening of the extremity, crepitus. So when you say crepitus, it is a grating sound or sensation, usually resulting from contact between bone and cartilage, especially when fractures are involved. So ito yung naririnig natin na sounds kapag nagkakaroon ng contact between si bone and cartilage. And then local edema and ecchymosis. So these are the manifestations of a fractured bone. So the diagnosis of a fracture is based on the patient assessments and x-ray findings. So commonly we use x-ray to diagnose fracture. Now alert. So testing for crepitus can produce further soft tissue damage and should be avoided. So kapag may naririnig na tayo na tunog or grating sound or sensation when we move the body part, that is a crepitus. So hindi na natin siya inuulit-ulit. Okay, because it might produce further tissue damage. So this one is an example of a fracture. Okay, so pathologic fracture. So emergency management kapag may fracture si pasyente. So whenever a fracture is suspected, it is important to immobilize the body part before the patient is moved. So again, immobilize the body part involved before moving the patient. Joints proximal and distal to the fracture must be immobilized to prevent movement of fracture fragments, as this may cause additional pain, soft tissue damage, and bleeding. So temporary, well-padded splints firmly bandaged over clothing serve to immobilize the fracture. So this one, ayan, naglagay sila ng splint dito sa fractured part ni patient. And then here is another splinting na ginawa sa ating pasyente na nagkaroon ng fracture. Okay, so that is a management. Oh, another emergency management with an open fracture naman, the wound is covered with a clean, sterile dressing to prevent contamination of deeper tissues. So pag open fracture kasi, di ba, there is a break in the skin integrity sa ating um, pasyente. So if that is the case, cocover natin siya ng clean or clean dressing kung meron, and then sterile dressing kung meron tayong available. If not, so pwede kahit clean dressing na lang para lang ma-prevent yung contamination doon sa affected body part. So no attempt is made to reduce the fracture even if one of the bone fragments is protruding through the wound. So kahit na nakaprotrude yung bones, tapos gusto mo sanang ipasok yung bone sa loob kasi nga nakaprotrude siya. So you should not attempt to do so. And then do not attempt to reduce or to realign or to fix the fractured bone because again, baka makasama pa sa pasyente. So again, you just have to cover it with a dressing, immobilize, and then dalhin sa pinakamalapit na hospital. Let the physician do the reduction. So, hayaan mo na si doktor gumawa ng pagre-reduce na yon. Okay, so let us now discuss the medical management, which is reduction. So pag sinabi nating fracture reduction, this means setting the bone. So it refers to the restoration of the fracture fragments to anatomical alignment and rotation. So ito yung na-discuss natin kanina na reduced, yung nire-reduce natin yung bone or ginagawa natin yung reduction. So that is fracture reduction. Nire-realign natin yung na-dislocate or yung naging, for example, nagkaroon ng misalignment or hindi natama yung anatomical alignment ng bone. So, pag sinabing we reduced it, meaning kinorek natin yung body part na affected. Nire-align natin or inayos natin yung body part na yon or yung, for example, the joints or the bone. So either close reduction or open reduction. Pag sinabi open reduction, again, that is using surgery, open surgery may be used. So again, sa pag re-reduce ng fraction, pwedeng closed, pwede ring open surgery or open reduction. Now, usually the doctor reduces a fracture as soon as possible to prevent loss of elasticity from the tissues through infiltration by edema or hemorrhage. So, syempre, nagkaroon ng trauma, so it might cause hemorrhage and edema of the body part. So, magkakaroon ng loss of elasticity yon if hindi i-reduce or hindi aayusin yung affected body part. So before fracture reduction and immobilization, the patient is prepared for the procedure. Kasi nga, sinabi na natin kanina na it is painful. So we have to prepare the patient kapag i-reduce na yung kanyang fracture. So we have to obtain consent for the procedure and an analgesic agent is administered as prescribed. Sedation or anesthesia may also be administered since that would be painful. So we have close reduction. So pag sinabing close reduction, this is accomplished by bringing the bone fragments into opposition. Example, placing the ends in contact through manipulation and manual traction. So pag close reduction, we are using the physician is using his or her bare hands to reduce the affected body part. Okay, so manual traction or manipulation para maayos yung bone na yun or yung fracture. So the extremity, just like in this example, so the extremity is held in a desired position while the doctor applies a cast, splints, or percutaneous spinning may be used. So the immobilizing device maintains reduction and stabilizes the extremity for bone healing. So i-reduce mo na yan, ayusin mo muna ni physician, manual traction or manipulation. So that is close reduction. So pag na-reduce na, doon pa lang siya pwedeng lagyan ng splint or ng brace or ng cast for immobility or immobilizing the body part. Okay, so that is closed reduction. So when we say naman open reduction, so ito yung na-discuss natin sa ating previous musculoskeletal care modality, si ORIF. Okay, so when you say open reduction, some fractures require open reduction with or without internal fixation of the fracture fragments. So pag sinabing internal fixation, naglalagay tayo ng metals, for example, para maayos yung fractured bone, such as this one. So ayan, ito meron tayong internal fixation na nilagay. Pero let's define first what is an ORIF. So open reduction with internal fixation. Although na-discuss natin siya previously, so si ORIF, it uses device nga such as metallic pins, wires, screws, plates, nails, or rods to hold the bone fragments in position until solid bone healing occurs. So open reduction, again, pwedeng with or without internal fixation. So in this case, meron tayong ginamit na internal fixation. So sa loob yan, pagka internal fixation, naka-embed siya inside the body part or kasama siya sa bone ni pasyente. So open reduction with internal fixation, meaning i-open surgery si pasyente and then mag-iiwan tayo ng either metallic pins, wires, screws, plates, nails, or rods para ma-promote yung healing in that bone. So for example, ito, this one. So ito yung fractured part. So naglagay siya ng like screws or nails or rods, pwede, para ma-promote yung union ng bone na yan. Okay, para magkaroon ng bone healing. So that is internal fixation. So yun yung ating types of reduction, either closed reduction or open reduction. So another medical management naman, we have immobilization. So after the fracture reduction, so after nating ma-realign yung bone, after nating maayos yung somehow anatomical position of the affected bone, or for example, joint, so the bone fragments must be immobilized until union occurs. I-immobilize natin siya. Again, after reduction, immobilize natin yung bone or yung fractured yung fractured na body part. So immobilization may be accomplished by external or internal fixation. So yung external fixator, di ba nakita nyo previously rin sa ating musculoskeletal care modality, ito yung mga pins din na nasa labas naman, kaya siya external. Okay, and then yung internal, yung kanina, ito yon yung sa picture natin. Ayan. So that is the internal fixation. So methods of external fixation, ayun, it may include bandages, casts, planes, continuous traction, and external fixators. So yun yung mga na-discuss nating modalities previously. So those are the ways to immobilize the fractured bone. Now, how do we maintain and restore the function of the affected body part? So edema is controlled by elevating the injured extremity and applying ice as prescribed. So we have to elevate the involved body part and then we may apply ice para ma-prevent yung edema on that fractured area or fractured part. Neurovascular status again, so yun na naman si 5Ps natin, circulation, motion, and sensation, or yung 5Ps is monitored routinely. And then if there is a deviation, we notify the physician immediately. That is very important, no? Again, notify the physician if there is any abnormality on the neurovascular status of the patient. Yung 5Ps, kung may na-observe tayo doon, such as pain, paresthesia, among others, we report that immediately to the physician. Restlessness, anxiety, and discomfort are controlled with a variety of approaches such as reassurance, position changes, and pain relief strategies, which includes the use of analgesic medication. So mahalaga na kino-comfort natin si patient, okay, para vent out niya yung kanyang hinaing or yung kanyang anxiety. So, patients with closed fractures, ano yung nursing management natin? Kapag si patient ay may closed fracture. So, ibig sabihin, hindi lumabas yung kanyang fracture outside the skin. So, ito yung management natin as a nurse. We encourage patients to return to their usual activities as rapidly as possible, and then educate the patient about exercises to maintain the health of the unaffected muscles. So definitely yung unaffected muscles, we promote its mobilization through exercise. Patient education. So we educate the patient sa fracture healing, which involves many processes with initial healing completed as early as 3 to 4 weeks. Though complete healing or remodeling of the fractured bone may take years. So, ganun siya katagal to completely remodel or completely heal the fractured bone. So, fracture healing and complications. So, generally, fractures of flat bones, such as your pelvis, sternum, and scapula, heal rapidly, while complex comminuted fractures may heal more slowly. So, yung mga flat bones natin, mas mabilis sila na mag-heal. Okay? Fractures at the ends of long bones where the bone is more vascular and cancellous heal more quickly than do fractures in areas where the bone is dense and less vascular. Basta kapag yung bone is rich with blood supply, mas mabilis yung kanyang healing. Okay? Compared sa mga less yung blood supply na bones natin, such as yun na nga yung mga so yung mga dense and less vascular, such as the mid shaft of the bone. So mas mabagal siyang mag-heal in comparison sa ends of the long bones where bone is more vascular and cancellous. Now, I just added here the different factors that affect fracture healing. So this is an FYI to you guys. Kindly read na lang the different factors that enhance fracture healing. So paano mapapabilis yung paggaling ng fracture. So you may follow this one. And then factors naman that inhibit the fracture healing, ito dapat yung ating iwasan para syempre mas gusto natin mas mapabilis yung healing ng fractured bone sa ating patient. So fracture healing and complications. So let's talk about the complications na involve kay fractured bone. So first we have shock. So in terms of shock, we have hypovolemic shock or traumatic shock. So it results or resulting from hemorrhage and from loss of extracellular fluid in the damaged tissues, which are more frequently noted in trauma patients with pelvic or long bone. For example, yung femoral fracture. So common si pelvic or long bone fracture such as femoral na magkaroon ng hypovolemic shock or traumatic shock. So, ayun. So that is the first complication. We have to take note of this, yung shock. And that is hypovolemic or traumatic shock. So, that is bleeding sa extracellular fluid. Okay? If hindi natin na-notice yun as a nurse, then ayun, mag-lead nga siya to a hypovolemic shock. At ayaw natin mangyari yun. So commonly, sa pelvic or long bone siya nangyayari na fracture. So that's the first complication, an early complication of fracture, shock. So again, that is because of continuous bleeding of the affected body part sa extracellular fluid. Next, another early complication is FES. Ang tawagin ay fat embolism syndrome. Again, FES, fat embolism syndrome. After fracture of long bones or pelvis, multiple fractures or crush injuries, fat emboli may develop. Again, involving pa rin to sa long bones or pelvis natin. Sa mga may multiple fracture or crush injuries. So, fat emboli may develop. So, when you say fat embolism, it refers to the presence of fat droplets through the peripheral and lung vasculature. So, alam naman natin na yung long bones natin consists of fat, di ba? So, if fatty tissue or fats nga. So, if that is the case, nagkaroon tayo ng fracture, so definitely, it is, I mean, that bone is at risk or it may develop a fat embolism or a fat emboli. So when you say fat embolism, it refers to the presence of fat droplets to the peripheral and lung vasculature. So nagkaroon tayo ng fat droplets sa ating peripheral blood vessel and sa ating lung vasculature. And we do not want that to happen. So fat emboli commonly occur after fractures in the long bones of the lower body, particularly the femur, excuse me, thigh bone, tibia, such as shin bone and pelvis. So sa mga long bones commonly, nagkakaroon tayo ng fat emboli. Wherein rich yan sa fats. So fat embolism syndrome or FES is a potentially critical manifestation of fat embolism and occurs typically within 24 hours of the injury and rapidly leads to a life threatening situation, or it may rapidly it's a life threatening condition sa ating pasyente kapag fat embolism syndrome yung pinag-uusapan. Okay? So again, typically within 24 hours of the injury involving the long bones. So ano yung ating clinical manifestations for fat embolism? So there's a classic triad of clinical manifestations of FES or si fat embolism syndrome. So the classic triad, yung tatlo na to are, we have the hypoxemia, neurological compromise, and a petechial rash. Although not all signs and symptoms manifest at the same time. So again, the three classic triad for FES or fat embolism syndrome, you have hypoxemia, okay, and then you have neurological compromise and petechial rash. So for the typical first manifestation among the triad is yung pulmonary muna. Okay, so the first manifestations are pulmonary and include hypoxia and tachypnea. So there will be a problem first kapag may FES si patient. So ang unang symptoms or sign is nagkakaroon tayo ng pulmonary manifestations such as tachypnea or hypoxia, nahihirapang huminga si patient, or nagkakaroon tayo ng kakulangan sa oxygen sa paghinga sa ating pasyente. Okay? So that is the first. Then, neurological manifestations typically include cerebral disturbances. So after ni respiratory, si neuro manifestations naman will follow. So this is due to hypoxia and the lodging of fat emboli in the brain. So kung makaabot si fat emboli sa, for example, sa utak ni pasyente, so there is neurological manifestations. And it manifests such as changes in the mental status of a patient, varying from headache and mild agitation to delirium and coma. That is the severe manifestation. Okay, so that is under neurological. Now, subtle personality changes, restlessness, irritability, or confusion in a patient who has sustained a fracture are indications for immediate patient assessment, including arterial blood gas study. So if ever na magkaroon ng subtle personality change si pasyente after having a fractured bone, especially sa long bones niya, so we have to be alerted immediately. And then we have to consider na probably it's the complication of the fracture, and that is either the FES or fat embolism syndrome. So that is the ano, so you have the una is the respiratory problem. Pagka may FES tayo, so it manifests muna sa respiratory and then neurological manifestation. And then the third one, you have the petechiae formation or petechial rush, di ba? Kung kanina yun sa classic triad natin. So such as in these images na pinapakita, petechiae formation tends to occur within 48 to 72 hours post-injury and almost always occurs after pulmonary and neurological manifestation. So mauna muna pag may FES si pasyente, fat embolism syndrome, mauna si pulmonary followed by neuro, and then huli si petechiae formation. Okay, and its manifestation may be due to a transient thrombocytopenia. Now, classically, these petechiae are noted in the buccal membranes and conjunctival sacs. Conjunctival sacs such as in this image, so nakikita natin na may petechial rush si patient. Sa hard palate, pwede rin siyang makita doon, and over the chest such as this one. Ayan, and the anterior axillary folds. So the petechiae are not present on any posterior body surface. So walang petechiae sa posterior body part ni patient. So the patient also develops a fever greater than 39.5 degrees Celsius. That is high. Okay, nagkaroon na ng almost hyperpyrexia na si pasyente. So, prevention management natin sa FES or fat embolism syndrome. So, alam na natin yung classic triad. So, how do we prevent FES? So, immediate immobilization of fractures, minimal fracture manipulation, and maintenance of fluid and electrolyte balance are measures that may reduce the incidence of fat emboli. So, we have to observe this. So, again, immobilize agad yung fracture, minimal yung manipulation, and then provide fluid and electrolyte sa pasyente. Vasoactive medications to support cardiovascular function are administered to prevent hypotension, shock, and interstitial pulmonary edema. Okay, so those are the management. So that is the first, so we discussed already two early complications ng fracture. So first one is shock, either hypovolemic or traumatic shock. The second one is si FES natin, fat embolism syndrome. So the third na to actually, na complication, si compartment syndrome. So na-discuss natin to previously sa mga patient na may CAS, di ba? So there is a possible complication or developing compartment syndrome. So let's discuss compartment syndrome again. So this is an anatomical, when you say compartment, or anatomical compartment, it is an area of the body encased by bone or fascia that contains muscles, nerves, and blood vessels. So normally, meron naman talaga tayong mga anatomical compartment. Okay, so such as this one. So we have here compartment. And then mamaya sa image ko, I will show you other compartments in our body part. So the human body has 46 anatomical compartments. So madami talaga siya, and 36 of these are located in the extremities. Now, acute compartment syndrome, so this one is yung complication na. It involves the increase of pressure within a muscle compartment, leading to a severe decrease in blood flow to the tissues distal to an area of injury that results in ischemic necrosis if decisive intervention does not occur. So, pagka nagkaroon ng pressure sa compartment na yon, and then nagkaroon ng decrease in blood flow sa tissues surrounding that compartment, and then leading to an injury and then ischemic necrosis, so that is the acute compartment syndrome na. So, ito yung mga compartments na meron tayo. So, for this one, compartments of the left lower leg. Yung letter B, yeah. This one, compartments of the left forearm to. So, ito yung forearm natin, left forearm, and ito yung kanyang mga compartments. So, you have here, ayan. So, and then, what else? Itong letter A is the compartments of the left lower leg. Ito yung left lower leg natin. Ito naman yung mga compartments. Anterior compartments, lateral compartment. So normally, again, we have compartments in our body, in our extremities. So in the case of compartment syndrome, nagkakaroon tayo ng increased pressure sa compartments na yan that leads to the decrease of blood flow in the surrounding tissue. At kapag nagkaroon tayo ng decreased blood flow, definitely magkakaroon ng ischemia yung surrounding tissue that could lead to tissue injury. And that is a compartment syndrome. Now, the pressure within a muscle compartment may increase to such an extent that microcirculation diminishes, causing nerve and muscle anoxia and necrosis. So, severe na kapag nagkaroon tayo ng nerve and muscle anoxia and necrosis. Okay? So, permanent function can be lost if the anoxic situation continues for longer than 4 hours. So, since nagkakaroon tayo ng decreased circulation, nagkakaroon ng decreased oxygen supply doon sa affected body part na may compartment syndrome, pag hindi na correct yun within 4 hours, then permanent function might happen to that body part. So, assessment and diagnostic findings, the patient with acute compartment syndrome in the extremity complains of deep, throbbing, unrelenting pain. So, ayan yung characteristic ng pain niya, deep, throbbing, and unrelenting, which continues to increase despite the administration of opioids and seems out of proportion to the injury. So, nakikita natin na hindi siya proportion sa injury na meron siya. So, parang lumalaki yung body part or parang, yun nga, na talagang nagkakaroon ng edema on that part. So, unrelenting pain, ibig sabihin, kahit nabigyan mo siya ng opioids or analgesics, hindi nawawala yung pain kapag compartment syndrome. So, a hallmark sign is pain that occurs or intensifies with passive ROM. So, pag passive ROM natin yung body part, yung pain is being intensified. Mas nararamdaman ni pasyente masakit yung body part pag pinapassive ROM natin. So, pain intensifies with dorsiflexion of the affected extremities. For example, the dorsiflex natin, yung affected body part, so si patient has an intensified pain. Okay? So, that is a hallmark of compartment syndrome. So, again, early detection of compartment syndrome is essential and involves a frequent assessment and documentation of the neurovascular function after fracture and focuses on the 5 Ps. So ito ulit yung 5 Ps natin for the neurovascular assessment or status. You have pain, paresthesia, paralysis, pallor, and pulselessness. So that is the 5 Ps of neurovascular assessment. Remember that. Dapat by now, you already memorize those. So, with continued nerve ischemia and edema, the patient experiences sensations of hyposthesia. Okay, so when you say hyposthesia, it is a diminished sensitivity to stimulation. So, habang nagpapatuloy yung compartment syndrome, nagkakaroon na ng diminished sensitivity sa body part na yon si pasyente. And then absence of feeling kapag talagang hindi pa na-correct yung compartment syndrome. So motor weakness may occur as a late sign of nerve ischemia. So no movement or paralysis suggests nerve damage. So kapag hindi na magalaw ni patient yan, that is severe. So paralyzed na siya. So it suggests nerve damage na. Pulselessness is a very late sign that may signify lack of distal tissue perfusion. Again, pulselessness is a very late sign that may signify lack of distal tissue perfusion. So what is our medical management for compartment syndrome? So the doctor needs to be modified immediately if neurovascular compromise is suspected. So we report naman lagi to our patient if we have noticed any deviation during the conduct of our neurovascular status, elevation of the extremity to the heart level, release of restrictive devices. Kung mayroong, for example, naka-restrict sa body part na yon, we release that device. Releasing dressings, for example, and bandages, or kung nakakast siya, binabivalve natin yung cast, meaning ino-open natin yung cast para makahinga somehow yung body part na yon. So, prolonged pressure of more than 30 millimeters of mercury can result in compromised microcirculation and fasciotomy. So, kapag talagang kailangan na, so piniperform ni physician yung fasciotomy. When you say fasciotomy, this one, as indicated in this image, so it is a surgical decompression with excision of the fibrous membrane that covers and separates muscles. So it may be needed to relieve the constrictive muscle fascia. Kung talagang kailangan ng i-open yung body part na yon para, emergency talaga. So, piniperform na ni physician si fasciotomy. So, surgical decompression with excision of the fibrous membrane. So, that is the medical management for compartment syndrome. After fasciotomy, the wound is not sutured, but instead it is left open to permit the muscle tissue to expand. So, hinahayaan muna natin makahinga somehow yung body part na affected. And then it is covered lang with moist, sterile saline dressing or artificial skin. So, kinocoveran lang natin siya para definitely hindi siya super exposed naman. So the limb is splinted in a functional position and elevated to heart level, and prescribed passive ROM exercises are usually performed every 4 to 6 hours. So when the swelling has resolved and the tissue perfusion has been restored, so the wound is debrided and either closed or skin grafts applied. So you have to be alerted. Compartment syndrome is managed by maintaining the extremity at the heart level, not above heart. So heart level lang. Hindi mas mataas pa sa level of the heart. So that is how we manage compartment syndrome. Now we have delayed complications. So yung mga discuss natin kanina are early complications. Yung shock, such as hypovolemic and or traumatic shock, si FES or si fat embolism syndrome, and then si compartment syndrome, they are like early complications. Now we have delayed complications. First one, you have delayed union, malunion, and non-union. So when you say delayed union, we're referring to the bones here. When you say delayed union of the bone, it occurs when healing does not occur at a normal rate for the location and type of fracture. Meaning, yung expected mo na sana ay nag-unite na yung fractured bone, pero hindi pa pala. So that is delayed union. Hindi normal yung rate ng kanyang pag-heal. Delayed union may be associated with destruction or nagkaroon ng pulling apart of bone fragments, systemic or local infection, poor nutrition, smoking, and age. So these are the factors that may contribute to delayed union. So definitely, we prevent this we prevent its occurrence. Yung systemic or local infection, poor nutrition, inaayos natin yan. Smoking, we ask the patient not to do so during bone healing. Non-union naman, it results failure of the ends of a fractured bone to unite. Again, non-union, yung ends of a fractured bone, hindi siya nag-unite. Parang hindi siya nag-meet. Okay? Yung dalawang ends ng bones na yon. Okay? So that is non-union. Hindi siya totally sama, hindi siya totally unite together. So that is non-union. Pag sinabing malunion naman, it results from failure of the ends of fractured bone to unite in a normal alignment. Kung si non-union, hindi siya nag-unite totally, hindi siya nag-meet totally yung dalawang bones, si malunion, nag-meet sila, kaya lang abnormal naman or hindi tama yung kanilang pag-unite. Okay, so hindi tama yung alignment ng pag-unite kapag ka non-union, such as in this one. So ito yung non-union. So the bones did not unite or did not meet completely. And then ito naman is angulated malunion. Nag-unite siya kaya lang parang may konting angle. Or yun nga, hindi tama yung alignment ng bones. So in both instances, the patient complains of persistent discomfort and abnormal movement at the fracture site. So yan yung complaint ni patient. Factors contributing to union problems include infection at the fracture site, interposition of tissue between the bone ends, inadequate immobilization or manipulation that disrupts callus formation, limited bone contact, and impaired blood supply resulting in a vascular necrosis. So inaayos natin yan if yung mga factors na yan are present to our patient, because we really wanted to heal the bone completely. We do not want this kind of complications, delayed complications sa ating pasyente. So ano yung medical management natin for non-union? Internal fixation, bone grafting, electrical bone stimulation, among others. So, internal fixation, again, nilalagyan natin ng ano yan, ng metals or bakal para maayos yung alignment. Now, for bone grafting, the bone fragments are trimmed. Infection, if present, is removed and a bone graft is placed in the bony defect. So the bone graft may be an autograft, meaning the tissue is harvested from the donor for the donor, and then frequently from the iliac crest. And then, yung allograft naman, the tissue is harvested from a donor. So, pag allograft nanggaling sa ibang tao, pag autograft nanggaling mismo sa sarili natin. Okay, so that is bone grafting. Gumagamit tayo ng buto to correct the problem. So, that is the first delayed complication. So, delayed union, malunion, and non-union. So, another delayed complication is a vascular necrosis of bone, or kung tawagin natin AVN, a vascular necrosis. So, pag sinabi a vascular necrosis, this is also known as osteonecrosis. So, it is a pathological process that involves the interruption of the blood supply to bone that results in bone death. So, pagka nagkaroon tayo ng interruption in the blood supply of bone, so it may lead to bone death or a vascular necrosis. So, ibig sabihin, nagkaroon ng death of the bone because nagkaroon ng impaired circulation. So, this is the normal. Ayan. And then this one is a vascular necrosis. So, it may occur after a fracture with disruption of the blood supply, especially on the femoral neck. So, the patient may develop pain and experience limited movement. So treatment generally consists of attempts to revitalize the bone with surgical decompression, bone grafts, prosthetic replacement, or osteotomy. So those are the management for a vascular necrosis. And then another delayed complication aside from delayed union, malunion, non-union, and AVN, the third one is reaction to internal fixation devices. So, this delayed complication, the internal fixation devices are usually permanently implanted and only removed due to complications such as mechanical failure, or there is an inadequate insertion and stabilization. So, ito yung example ng internal fixation natin, meaning that metal or device is naka-implant na kay patient sa loob. So, permanently, nandiyan na yan. Matatanggal lang yan if there's a mechanical failure. If there's a material failure or there's a faulty damage or corroded device, if there's a local inflammation, there's infection or allergic response to the metallic alloy used, and abnormal osteoporotic remodeling. So, if these are the cases for internal fixation, then tinatanggal na natin yon. So, pain and decreased function are the prime indications that the problem has developed. So, pag nakaramdam na ng pain and then decrease of function si pasyente, so that is an indication na may problema sa ating internal fixation device. So if the device is removed, the bone needs to be protected from a refracture related to osteoporosis, altered bone structure, and trauma. And then after that, so the fourth delayed complication sa ating fractured bone is the CRPS. Pag sinabing CRPS, complex regional pain syndrome. Again, CRPS, complex regional pain syndrome. So it is formerly called as reflex sympathetic dystrophy. So it is a chronic pain condition that can occur after trauma and is characterized by nervous and inflammatory features. Again, ito yung pain na nararamdaman ni pasyente after yung trauma and characterized by nervous and inflammatory features. So yung manifestations ng CRPS or complex regional pain syndrome includes severe burning pain. So ito yung kinocomplain ni patient. Severe burning pain, local edema, such as in this picture, tapos stiffness and vasomotor skin changes, fluctuating warm, red, and cold, sweaty, and cyanotic, and tropic changes, such as glossy, shiny skin, increased hair, and nail growth. So, ayan, kita natin, di ba? Like shiny talaga yung skin ni patient here. So, disused muscle atrophy and bone deossification or osteoporosis occur with chronic complex regional pain syndrome or CRPS. So, treatment is challenging and involves physiotherapy, psychotherapy, and effective pain management. So, those are the different complications involving fracture. So, meron tayong early complications such as shock, what else? Si compartment syndrome, and then si FES. And then meron tayong delayed complications such as non-union, malunion. And then we also have si ating na-discuss na natin si reaction to internal fixation devices and avascular necrosis or si AVN. And the last delayed complication is CRPS. So, ito yung mga i-watch out natin if our patient develops or has a fracture or a fractured bone. So, that concludes my discussion. So, thank you for listening, and I hope that you have learned something from this discussion. So, thank you and God bless you guys.